This is a tremendous seller. Okay, this is boarded gauze. Now, what boarded gauze basically takes the place of tape and gauze. When it comes to tape and gauze, there's a lot of waste. Okay, they put on the gauze and they wrap it 14 times with tape. A lot of times when they do that, the wound is not getting any sufficient air. Sometimes, that wound needs air. The exit, especially when you're pulling out exudate, it needs air to dry itself out. You're not getting any air into the wound, especially when you're doing, a piece of gauze with a lot of tape. So a lot of times they're taking tape and putting it right over the gauze. They're not just going on the sides. What's nice about the boarded gauze as well is that this product, if you can see, you see the holes. There's holes throughout.
Of course.
There is air getting into the wound, so the wound will be healing right. Now, depending on the size of the wound, if it's a large wound, you're going to use a 6x6. If it's a smaller wound, you're going to use a 4x4. And really, it does stick very well. At least the product that I manufacture does. We try to, because we want to make it conform to the body. And if it's on a shin, or if it's on a knee, or if it's on, even on the patient's butt, it's got to be able to move around. The patient has to have some kind of, moving with it. If you can see this, really, it does move. So this really takes the place of tape and gauze. Instead of buying two products, they're now buying one product. And they're actually helping the wound, because they're not, a lot of times when they use tape, they cover up the whole wound. So no air is getting inside over there. Here you've got air coming inside over here. And a lot of, as much as they say they're going to use a Telfa pad, sometimes they forget to use a Telfa pad. Now, you go try pulling off off a stage 3 or a stage 4, a wound. You ever have a Band-Aid that you might have put on by mistake that didn't have a Telfa pad, and then you have to take it off, and you count 1, 2, 3, and then pull it off, and it hurts? So that's the advantage of this. You've got the Telfa there, you've got the gauze, and you've got the tape, all in one. And as well, this is very easy.